Hi, I'm Chris Wallis here at ASCO GU 2024, and I'm really pleased to be joined with Dr. Karen Hoffman from MD Anderson, and she presented just minutes ago results of patient-reported outcomes and health-related quality of life in the FORMULA-509 trial. So thanks so much for joining us today.
Well, thank you so much for the invitation, Chris.
So I think, it's really important when we think about prostate cancer, and particularly localized prostate cancer, to think about why we're doing what we're doing. And the trials are always oncologic endpoints, but I think you probably share the notion that patient-reported outcomes and health-related quality of life and these whole survivorship concepts are really important. So tell me how it fits into trial design, for example, like a study like FORMULA-509.
Sure, I absolutely agree with you, Chris. So I do think it's important that whenever we're designing a trial that we do our best to also include patient-reported outcomes. Often in our trials we're looking to kind of improve oncologic outcomes, and that certainly was the case in the FORMULA-509 trial, and we identified a subgroup of patients who did benefit from the more intensified ADT. But I'm very glad that when we designed the study we included patient-reported outcomes because patient perception and patient experience really can often be different from physician assessment. So it's really a great way for us to better understand what the experience is like from the patient perspective. And ultimately, it is a balance between kind of improving oncologic outcomes and seeing how it impacts individual patients.
Absolutely. And so maybe just to give us a bit of a context for FORMULA-509, this is a trial in the salvage space. What kind of patients are here, their disease profile, and what's FORMULA-509 assessing the question?
Sure, absolutely. So for patients who have prostate cancer recurrence, usually biochemical recurrence or recurrence just in the pelvis after prostatectomy, they receive salvage radiation therapy. And currently, work is ongoing to understand how to best optimize the systemic therapy given with salvage radiation therapy. And so that was the concept and the emphasis behind FORMULA-509. It really can, one of the standard therapies right now in combination with salvage radiation therapy is 6 months of kind of traditional ADT, often has been, GNH agonist ADT. So at the FORMULA-509 trial, it was looking to intensify ADT, taking some medications that have worked well, kind of in the more advanced space, and now bringing them earlier. So in FORMULA-509, it was the addition of abiraterone plus prednisone and apalutamide to GNH agonist, and then that was compared to GNH agonist plus bicalutamide, so both with 6 months of ADT.
Right, and this time last year we saw the oncologic endpoints where we're showing that benefit in the patients with a higher pre-salvage radiation PSA.
Yes.
What did you show today in terms of health-related quality of life effects?
Sure. So today we were very happy to share patient-reported outcomes. So in FORMULA-509, patients' health-related quality of life was assessed with questionnaires that were administered at baseline, at the completion of their 6 months of systemic therapy, and then 1 year after completion of therapy. The patients completed the Expanded Prostate Index Composite 26. We highlighted today the hormonal domains and the sexual function domains, the PROMIS fatigue short form 4, and then also the St. Louis University mental status examination. So that's what I presented today. And what we found is with regards to the EPIC 26 hormonal domain, patients in both treatment arms reported a clinically meaningful decline in hormonal function at end of treatment, which then improved towards baseline at 1 year of follow-up. But notably, there was no difference in patient-reported hormonal function between treatment arms at end of treatment as well as at 1 year of follow-up. It was a similar story with regard to the EPIC 26 sexual function. So there was no difference between treatment arms with regards to patient-reported sexual function at end of treatment and 1 year after a completion of treatment. They were somewhat limited by the conclusions we could make because within this group of patients, all of who'd had prostatectomy previously, their baseline sexual function was generally overall poor.
Surgeons aren't giving them much to work with?
Well, there's multiple factors that play into individual sexual function, right? But at baseline, only 21% of them had erections sufficient for intercourse. So we found, as I mentioned, no difference in impact on sexual function. With regards to patient reported fatigue, we did see, in both treatment arms, an increase in patient-reported fatigue at end of treatment, with subsequent improvement towards a baseline by 1 year as well, with no difference in patient-reported fatigue at end of treatment and 1 year after completion of treatment. With regards to cognitive function, as mentioned, we assessed that with the St. Louis University mental status exam. We didn't detect, an impact or a difference using this measure with the treatments, and then there was no difference in cognitive function between the treatment arms at end of treatment or 1 year after treatment. So in summary, across the different measures that we looked at, patients reporting, similar health-related quality of life, whether they were having, kind of the more standard 6 months of ADT regimen or the intensified regimen. So we found this to be very reassuring in terms of using this with our patients in the clinic where we think it may be of benefit.
Right, and so when we try to take it to the clinic, I guess, our current standard of care, depending on whether you use the Shipley data or some, some other data right now, is relatively short-term. Traditional ADT. This is a paradigm where you add intensity. Radicals adds duration rather than intensity. How do we put together all this and what would you pick going forward in these patients you're maybe most worried about?
Sure, and as you highlight, there's different studies that have been looking at different approaches, to improve patient outcomes within this group. Several that are comparing, a 6 months of ADT regimen to something different. Radicals HD has reported their findings, and with their approach, which was lengthening the duration of ADT to 24 months, did demonstrate, improvement in metastasis-free survival compared to 6 months of ADT. I mean, if we putting FORMULA-509 results in this context, our approach was the more intensified ADT regimen of 6 months. So once that was done, the patients had the opportunity to then have testosterone recovery, which likely links to improvements in health-related quality of life. I mean, we were seeing improvements from end of treatment to the 1 year follow-up. And at that point in FORMULA-509, about 80% of patients had testosterone recovery. So, we think, with our approach, kind of shorter, more intensified, patients are likely to experience better quality of life, kind of at least in that kind of shorter term period, than patients who may be having a longer 24-month duration of ADT, like on Radicals HD. It's something that we're going to be looking at. It's something we're going to be testing in our next trial called the Prostate IQ trial, where we'll be comparing the two approaches, lengthening ADT 24 months versus a more intensified ADT regimen, similar to FORMULA-509, but for this one, we're using just the apalutamide. We're not including the abiraterone. And then, we have actually even more robust health-related quality of life outcomes than we have in FORMULA-509. So
fantastic. When can we look forward to those data?
Well, we're looking forward to kick off enrollment this kind of spring, summer. So we likely won't have data for at least 5 years, but
Absolutely.
Soon.
Fantastic. Well, thank you so much for taking the time and sort of giving us insight into how patients' experience of biochemical recurrent treatment goes. And
absolutely, and obviously it's always important to individualize it for an individual patient, their preferences, what their goals are. But it's really nice, I think, to have some patient-reported outcome data to help and inform those discussions.
Absolutely.
All
Thanks so much for your time.
Thank you.